So you had a procedure that you desired, which was called breast reduction. And kind of take me through what your thinking process was and why did you decide to have that procedure?
Of course. Well, I suffered from back pain for over 25 years. And then I was also burdened with, triple D cup size. And I just knew it had to have something to do with the back pain. The pain in the back was exactly, in the opposite spot of my breast. So that drove me to come and see you to ask if you could, decrease some of the pain and increase my quality of life. And I was really happy when I met you because you were professional and caring. I could tell you cared about your patients, and you treated me with respect. And I felt almost immediately that I was going to be in capable hands if you were to do the surgery for me.
Have you been thinking a long time to get this done?
I
Is it
had.
always in your back of your mind?
It was in the back of my mind for 10 years. And I would, Google it and read about it and put it aside and then pick it back up again and wonder. And part of it was I waited till I was beyond the postmenopausal because my body kept changing during that time. So I promised myself when I was through with that I would pursue it. Then the problem I had was my general practitioner gave me 2 names of doctors who I'm sure they were good, but they weren't interested in my insurance at all. So that was like, well, I believe it's medically necessary, so I wanted, to have some support from
Was the
insurance.
process of getting in to see us and
It was
everything,
easier than anything. I just, I'm the one that stumbled upon you then because one of the doctors that they referred to said, why don't you call the Seton Institute of Plastic Surgery? I believe that they would be interested in your insurance. And so I called in with immediately, I think I was talking to Sarah or someone, but they had, you just had all my records as soon as I consented to them.
That's good to know too.
Right.
So somebody works with a medical record at least.
Yes, because I was also a little stressed out thinking, how am I going to cobble together 25 years of back problem document, thinking that it would be, on me to get that. But your ease of use was just phenomenal.
Fantastic.
Took a lot of stress
Kind of describe sort of the symptoms you were having that would lead you to think that the pain's coming from your breast.
So the pain was always, just like right in back of my breast, just really tight stabbing pain. And it would be better if when I was home and nobody was looking, I would just hold myself up there and walk around and I'd say, well, this feels amazing, without this burden holding myself up in a way of rock. Never again. My neck hurt, the straps, the bra straps, cutting in is never comfortable. As you know, I stand 8 hours a day for my job. That felt like it was a penny.
Many bras, or you had difficulty finding them?
Yes, and right. There was always
typical problems.
They were huge,
So,
made me depressed.
Having the surgery, we had the discussion about what it was going to involve. Did I tell you anything, or was there anything that we needed to tell you that you didn't expect, or what were your expectations?
Pretty much, you told me what I was hoping to hear and needing to hear, that you felt you could help reduce the pain. And may I add that my back was saying thank you within a few days.
That's incredible.
Yes, I thought so too. I really didn't expect to feel that much difference immediately,
Okay.
but I did. And you went over everything. Sarah was also very helpful because when you and I were through, then you turned it over to her, and she was like counseling me. I felt like to make sure, if you thought about this, this is a big step. She gave me food for thought and convinced me that I had already made up my mind that I wanted to do it.
Excellent. And then, so post-op recovery, was it as painful as you thought? Was it easy, hard? How would you describe it?
I don't think that we would call it easy, but it was not nearly the pain that I would have anticipated. And you called me that night to make sure that I was okay, and I really felt I was. I never needed anything but the Tylenol that you both told me at post-op to, take something because it takes the pain.
Part of it's a testament to you. Yeah, part of it's a testament to you. If you feel like that you can manage it, that's great.
Right.
I think we want to not set expectations that you're going to have pain, but you had surgery and it's a big operation.
Right.
We want to make sure that you're comfortable enough where you have the ability to take it. But again, if you're saying that it wasn't as bad as you thought.
It wasn't as bad as I thought. And I think a part of that was the back pain that I had was, for me, debilitating. I couldn't concentrate on anything. I didn't want anybody to talk to me. It hurt to breathe. So whatever pain I had post-surgery felt to me like, oh, well, this is gonna go away in a week or so. The back pain would take 6 weeks before I could breathe again. So
You were happy right away.
yes, everything's relative to me. It was a minor inconvenience,
Fantastic.
which I understand that doesn't mean it would be for everyone.
And I just say, patients, they tell me that this is one of the best operations they've had done. If you had it again, there's an opportunity to do it again.
Yes.
What would you tell another prospective patient? What were some things that we didn't tell you and you would have liked to have known?
You know, I don't think there was anything you didn't tell me. You told me more than applied to me, so that you prepared me. Sarah at that pre-op appointment was very thorough. I mean, she told me everything from where to park at the hospital to an elevator to take to how to do immediate wound care and the drainage cups to the 3-month wound care. I felt that I was really well informed.
Fantastic. I'm happy if you're happy.
And I want you to know, when I was being wheeled into the operating room, the surgical nurse, who I guess works for Del Seaton, said to me, she reached down and she patted me on the shoulder. She said, "You're gonna be okay. This is one of my favorite surgeries to see women who need it get, because it improves the quality of their life so much." She said, "You're gonna do fine." And she said, "And you picked the best doctor for it."
That's really nice of her. I mean, keep her on my payroll. How about that?
Well, it made me, feel even better,
Yeah, no,
because
that's
it's a tense moment.
And we always like to say that it's not, I'm just a technician. Like, I think that's
No.
part of the surgery. It's not surgery, the doctor-patient relationship, obviously, but it's my assistants, my nurse, it's the crew of the hospital, it's the background, nerve, it's
Right.
all the
Got good
authorization.
staff.
So I think we have to kind of make sure that the patient's experience is not just your health, obviously it's important, but the whole process.
Sure, the business end of it was important too, to make it so
Yeah.
easy. And I felt, felt that I just waltzed in and had it done to me, that y'all did the rest of it.
I'm happy to-
So I appreciate it. I'm
Anything
really
else?
happy. It's changed my life on many levels that I didn't expect.
Fantastic.
And I meant, in a good way, it's changed it. I was looking for relief of back pain, and I got it, but I got a lot more.
Excellent. That's the way we say that. Thank you very much.
Thank you for everything.